Good morning, Peter Goertz. I'm a psychiatrist. When to let a patient die? This question comes up sometimes for doctors, and it can be a tricky, difficult question to respond to and get ideas regarding how to act. And the other side of that coin for me is it's interesting and also nice in a way because not everything in medicine is cut and dried, far from everything. Not everything is logical and neatly organized. So there's a lot of room for creativity and flexible thinking. I do a lot of consultations for medical floors, so I see a lot of medically sick patients. And recently I saw two patients, one of them middle-aged, not very old, had had a stroke, a very serious stroke, was not eating much and not drinking much, not taking his medicines by mouth, and doing poorly medically, and the question was how to proceed with him. And another patient, an older lady, had pretty significant medical problems, and she had spiritual beliefs. She'd been, as per her, in contact with spirits since she was a child and was looking forward to dying. She'd had enough, basically. The medical problems were just not something she wanted to deal with. Of course, medical problems can get better, so it's always a tricky situation. But from her perspective at that point, she was ready to go, ready to die. So we're looking at medical, ethical, legal, spiritual aspects of this issue. Professional organizations have their own guidelines often. Different countries have different laws regarding this issue. We want to look at our own feelings, of course, also as medical staff. If a patient dies, that does not necessarily constitute a failure on the part of the medical staff. And some people based on their training may feel their job is to save someone's life, keep them alive, but that may or may not always be the best thing. We want a patient, this is all my opinion, of course, my personal opinion. So we want to make sure as much as we can that a patient lives and dies with respect, dignity. Having a living will can be helpful. Having a clear will in general for the patient can be helpful, and that can help a lot with the family later on after the patient dies. And having someone who has medical power of attorney can be very helpful. We want to make sure the patient has made a decision whether they want to be resuscitated or not. That can be tricky. The patient may want to change their mind at some point. So we want to look at all this on an ongoing basis, day to day, be flexible in our thinking. And if we're thinking of, is it time to let a patient die? We want to look at what is the quality of life. If at all possible, we want to look at that issue from the patient's perspective, which we can't really have totally, but get some idea if possible. So the first patient I mentioned, who was not eating or drinking much, I spoke with his wife, and he had been enjoying some things, a good amount. So he enjoyed spending time with his children, who are still minors. So we don't want to really base decisions regarding when it's time to let a patient die on our own feelings about our own lives, but look at what the patient really feels as much as possible, as far as we can tell, about their own life. Are they enjoying things? Even if we, in the same situation, would not enjoy those things, let's say. As much as possible, family, friends, the medical team all need to get a feel for the overall situation. And it can be tricky. There can be tricky aspects. Some family members, for example, may benefit financially from the patient dying, so that may cloud their decision-making. People can be family, friends, the medical team can all be emotionally exhausted and want the situation to end, but that may not be in the patient's best interest. We don't know what's going to happen in the future. A new medication may change things medically, psychiatrically for the patient. Overall, it seems wise to act in good faith, in general, of course, but also in this type of scenario. And also, we want to make sure to act within the legal confines, within the legal rules of wherever we practice. Thank you.